Yeah.
Woohoo! Hello. Hey.
Ooh, sorry.
If that's your more head.
Ooh. Is it supposed to be like that?
Yeah.
Is there?
Oh, yeah, that's fine.
There.
Yeah.
He's there.
Okay.
It's fine.
There's no glare.
Okay, so when you're sick, or am I right? Yeah. When you're sick, what do? You go to the doctor. You tell them, doctor, hey, I have this, hey, I have that, I have pain here. But what do you do? But what does a vet do? An animal doctor. The animal can't tell them, oh, doctor, I'm hurting here. Oh, I'm hurting there. So that's one of the most difficult jobs of a vet, to like try to understand where the pain of their patient is coming from. So today I'll be telling you about how vets assess pain in animals and how they make their diagnosis. So it's difficult for vets to assess pain in animals, but it can be done. They have several methods to do it. Although it can be further complicated by other contexts as well. So first I'll explain why assessing pain is difficult in animals. There are several reasons. The most obvious is animals can't communicate. Whereas with humans, you can just tell a doctor, "Oh, a doctor, I'm hurting here." Animals can't do the same. So often, according to today's vet practice, March 2012 article, Pain Assessment in Dogs and Cats by Arusha Balakrishnan and Elena Benasuti, they often rely on owners to assess pain. Like the owners tell them, "Oh, doctor, my dog's been acting like this or that." But owners aren't usually vets, so they're not really a reliable source of information. Another difficulty they have, vets often find, is that many animals like to hide their pain, especially like prey animals like birds or something like that. Their instinct is to hide their pain because in the wild, if they show their pain, they're pretty much just telling other animals, "Hey, I'm an easy target." Yeah. I explained why it's difficult for vets to assess pain in animals, but there are certain methods that they use to find them. So the two most common methods they use are behavioral and physiological. So first, vets often look at their behavior. A lot of animals, they kind of have certain behaviors that are dead giveaways of what they're going through. So according to North Carolina State University's article, Pain Assessment Tools by Elaine, never mind. For cats, they often use something called the feline grimace scale, which is where they look at facial expressions, even like the tiniest little details about like how they're wincing, how their eyes are. It can tell them like what's going on with the cat. And that's something they do with a lot of animals. A lot of animals have like certain patterns that kind of just give away what's going on. Another way they assess pain is physiological. So according to the Merck's Vet Manual, March 2023 article titled "Recognition and Pain Assessment in Animals" by Sandra Allweiler. Like I said, they look at physiological signs like heart rate, breathing rate, temperature, just to see what's going on with them. So although there are ways to assess pain in animals, there are still other difficulties that they can find. For example, context. Like context often changes, what an animal is feeling, how they're expressing their pain, and can change the diagnosis that the vet finds. So first off, although there are like tools and scales that they use to assess pain, they're often inconsistent, especially among vet to vet. So according to Frontier's December 2023 article, Attitudes to Acute Pain and the Use of Pain Assessment Scales Among Spanish Animal Vets by Sandra Menendez and Miguel Cabezas and Ignacio Gomez, they report that only 44% of surveyed vets use pain scales. And even the ones that do, they often use like various different ones and interpret them differently, because there's not really any like universal way to define pain or like assess animals. So there's often a lot of different inconsistencies. You could take an animal to one vet, they'll tell you one thing. You take them to another one, they'll tell you something else. So that's often a difficulty that many animals face. Another thing that can affect diagnosis is medical history. Obviously, like an old dog that's had surgery, they're gonna have something different going on than like say a puppy that's never been to a vet. Things like that, like past medical history, can affect what is going on and how vets assess that pain. So even though it is difficult, it still can be done. Assessing pain in animals, it's still something they can do. Like I said, it's difficult to do, but there are ways to do it. But even then, there's still further difficulties. But still, vets play a crucial role in making sure animals are okay, and it's their job to try to figure out what's going on with them, and it's an important job they play. Yeah.
Nicely done.
Hey, congratulations.